Our group is going to cover the topic of coronary heart disease. Coronary heart disease is a heart disease in which there's plaque buildup in the arteries. This constricts the blood flow, making it harder for oxygen and blood to pump to the heart. Some symptoms of coronary heart disease include chest pain, shortness of breath, and nausea. People with high LDL cholesterol and low HDL cholesterol are most at risk, as well as those with high blood pressure and diabetes. In men, the risk of CHD increases past around age 45, and women's CHD risk increases past around age 55.
Some statistics for people who are most likely to have CHD are: for age 20 and older women, the percentage is 6.2. For white women, the percentage is 6.1. For Black women, the percentage is 6.5. And for Hispanic women, the percentage is 6%.
As for existing policies that help in the prevention of coronary heart disease, there really aren't any that specifically target the disease by name, but there are some policies that help reduce the risk for someone to possibly develop coronary heart disease. So there are 2 federal policies that the FDA has enacted that help in that, like the Family Smoking Prevention and Tobacco Control Act and the Nutrition Labeling and Education Act. And then as for the levels of prevention, for example, there is like non-governmental health agencies such as like the American Heart Association that help advocate for a healthier lifestyle that reduces the risk of someone having coronary heart disease. And then at the secondary level, there's the implementation of these actual lifestyle changes and developing healthier diet habits. And then there are actually some medical interventions, which include statin therapy or using beta blockers. And then at the tertiary level, there's some interventional procedures such as coronary bypass surgery, implanting pacemakers, or coronary angioplasty.
In the last 35 years, advances in the prevention, diagnosis, and treatment of common cardiovascular conditions have lowered U.S. age-adjusted mortality from cardiovascular disease by 50%. Such a rapid decline in deaths due to CHD shows that the measures we've taken have been successful thus far, as shown in this diagram.
Information about coronary heart disease is readily available to the public through reliable medical websites such as the CDC, Mayo Clinic, and Medline Plus. Treatment plans depend on how severe the disease is, the severity of symptoms, and any underlying health conditions. To seek care, people should go to a doctor for a 10-year risk calculation when deciding how to best treat the disease. A common misconception is believing that CHD is not preventable, but in reality, there are modifiable risk factors. Public health practitioners should increase CHD education that targets the knowledge gaps within all subgroups of people to make sure misinformation is not spread.